do have some information on the testing that has been done. I wanted to say about that, well, before I get into that, I wanted to say that the advisory to boil water remains on. The advisory to boil water for drinking or for washing fruits and vegetables that are not going to be cooked remains on. We did have tests on the Howard and Linwood treatment plants. The tests are encouraging. The Linwood plant is providing all of the water for the City of Milwaukee water utility, and as an additional precaution, this afternoon the water utility will begin replacing the coagulating agent as they did at the Howard plant. They'll also do that at the Linwood plant as a further precaution. They'll also eliminate backwashing at the Linwood plant. Our confidence level in the Linwood plant is increasing. This is the plant that's providing all the water for the city. They're also beginning today to flush the system, distal sites in the system. We are, though, awaiting more tests. The decision to put the boil order on was one that we could do. We could err on the side of caution. In this case, we want to do some additional tests before we lift the boil advisory. The additional tests will be available over the next few days, Monday and Tuesday. If the tests come in and are as encouraging as the original tests, then I expect to modify the boil order on Wednesday. I also wanted to talk a little bit about some other subjects before we open it up for question. There continues to be support for our hypothesis that the water produced by the plant on the south side was the problem. We have anecdotal information like school absentee rates and so forth. We also have yeah, you can turn them around. Dr. Davis and Paul Nannis and Dr. Schlenker can talk more about that later, but basically it shows that there's more cases on the south side of the cases involving stool specimens, where stool specimens were taken. That's a pattern of where people lived who had it, and also a pattern of where they worked. So that hypothesis is being supported by that. They're continuing to look for other categories of data, and Dr. Davis can talk more about that in a little while. Another hypothesis, which also is one that has attracted a lot of support from the research that's been done so far, is the connection between turbidity and in the water and the incidence of the problem. That is also something that Dr. Davis can talk more about. The data that we've been able to get, the information we've been able to get from the Howard plant on this is still preliminary, and we have no definitive indication on what kind of malfunction in the plant caused this, except for that part of this hypothesis is that the what's the name of the two? Alum and
polyaluminum chloride.
And polyaluminum chloride, that there may be problems with the ability of polyaluminum chloride to cause solids to settle, and that alum is better. And so now both plants, including the Linwood plant, will be converting to alum. That was originally, when did the original, when was the switch made?
The switch to polyaluminum chloride was made in mid-1992.
Mid-1992. And so that theory is also one that's being, that hypothesis is being explored. There are other actions that are going on that I wanted to mention. The EPA is sending an engineer, an expert on water treatment plants, will be here on Monday morning. He'll work with Dr. Davis and the Health Department and the engineers in the waterworks to try to determine how to improve the water treatment process or any of the other factors that are involved in the outbreak. I talked to the governor today, and he pledged his cooperation, and also Jerry Whitburn, the Secretary of Health and Human Services, sat in on our staff meeting just before this press conference. He and the governor have are letting the DNR know that they want them to conduct tests throughout the rivershed to help determine the origin of Cryptosporidium. All right. One of these days I'll have it down. And Dr. Davis had suggested this, and the governor is being very cooperative in working with us to resolve this crisis. They'll be doing testing throughout the rivershed for the organism. We've talked to the federal officials, and we've talked to people in the White House about possible financial help in moving the Texas intake out further so that it's out of the pollution plume that happens whenever there's large amounts of precipitation and the Milwaukee River enters the Lake Michigan. In hindsight, I wonder the same questions you do. Why on earth we ever had a water intake where the pollution plume is coming out, and we'll try to get a read on the history of that and find out why that happened. The basic questions that I think people are asking is what happened, why it happened, what are we going to do to make sure it doesn't happen again, and also most immediate, when is the end of the boil water advisory in sight? I'm not going to say that that the end of it is in sight, but if the tests come in and they continue to be encouraging, then Wednesday looks like the day when we're most likely to modify that so that people that are healthy will be advised that the water is safe to drink. We're going to have to work out exactly what message we want to give to those who have pre-existing health problems and how to deal with it, whether through filters or continuing to use boiled water or bottled water. Finally, I wanted to mention that we are aware of the death of a cancer patient who apparently had diarrhea. There is not enough information at this time to say that the death is related to Cryptosporidium, but the health department is looking into the case, and when we get any information on that, one way or the other, we'll pass it along to the media immediately. This is a dangerous organism to people who have pre-existing health problems, and that's why it's important for people to obey the advisory and not to consume water that isn't boiled or bottled. And so I wanted to bring that out so that you were aware of it. As soon as we find out more about that particular case, we'll pass on the information. With that, if there's some questions for me, and then we'll have the other people.
Mayor, you said the test results were encouraging. Was Cryptosporidium found in both the Howard Avenue plant and Linwood plant, and if so, at what levels?
Yeah, this is a good time perhaps to bring, you want to field that one? Or, yeah, I think that's more, there are trace amounts of Cryptosporidium from both, and maybe you can explain what that means.
To provide a background, these particular specimens were obtained after a time when an event that may have caused illness in people had occurred, and probably we're talking about quite a few days or perhaps a week or more. So it's not representative of anything that occurred during a high-risk time of this particular outbreak. However, the two specimens that upon which results are available so far were the first two specimens obtained and don't represent the longest duration of time specimens. But there was one Cryptosporidium organism per 50 liters found in the effluent from the Howard Avenue plant, and one organism per 78 liters in the Linwood plant. And it's not unusual for plants that depend on surface water and filtration to have a low level of Cryptosporidium in them, at very low levels. And we just need to wait and see what the results are now that changes in coagulation are taking place, and we have to see what the distal site samples show as well. These are only the first two samples back. Other samples will be obtained, and certainly that doesn't constitute a huge amount of Cryptosporidium by any means. The results certainly seem encouraging, given the fact that we would hope that we would find a clean specimen, and so we're at this point. We are looking forward to the results of other specimens that have been obtained but where processing is not yet completed, and the results of tests that will be obtained and sent to the lab. And I want to certainly let everyone know that the people in the laboratory have been doing an extraordinary job in making a high priority to processing the specimens.
Well, let me ask you the question that the mayor asked you a couple nights ago. Given those levels, and if they stay at those levels, would you drink that water?
I'm in the process now of trying to talk to people in a variety of settings that are most expert on this. I haven't completed my conversations with all of the people that I feel I need to complete my conversations with. Plus, I'm going to be privy to a lot more information that once we test it. At an appropriate time, when we get all of our tests back, I think we can make a statement. We're still in the testing phase, so I'm not going to answer the question quite that way.
Do you consider those levels low levels?
I'm told that those levels are low by some. It represents an unusual level in the sense that we need to look at further tests. Those are the first specimens. They're certainly not high. They're specimens that beg more information, I think, and that's really what we're doing. I think if you look at results from other water utilities, it's not unusual to find a low level of Cryptosporidium in water, and this certainly may represent that. It's not unusual to find Cryptosporidium disease throughout the country. It's a disease that has an endemicity that hasn't been fully measured, and so we're really talking about the initial two specimens that we have. I certainly wouldn't make too much out of these two specimens. I think we have to put the entire picture together and see what we have after more testing is available and we have more information.
Jeff, do you have any more information?
Just a little bit more on that. Another way to put that would be that if there hadn't been any of this problem and you came in and tested the plants and it had that level, that would not indicate that you wanted to turn off the water plant. But the fact that there's any in it at all certainly means we want to have more tests.
Is it safe to say that the levels, say 2-3 weeks ago, could have been higher? Or are you even ruling out that water is not the carrier for what's afflicted these people?
I don't think anybody's ruling out water. I think we're in the process of evaluating that very carefully, and there's quite a few different studies that we have going to look at that, and we'll report those data back to you as soon as we have them. In outbreak situations, when people are challenged, the number of organisms per liter is substantially higher than what we're reporting. We're probably talking about a low level of organisms. We need to understand that in relation to this particular system. Changes certainly have been made in one plant, are being made in another one. We haven't yet gotten results of the testing that's done after a change in the alum coagulation process. Let's see what those show. I mean, I think there's quite a bit that's pending before we can say more. So let's just, we're reporting results just as soon as we're getting them, and we'll be continuing to report results as soon as we're getting
But
them as well.
to answer your question about whether the levels were higher, if our hypothesis is correct, then the levels would have been higher out of the Howard Avenue plant back before changes were made. The test that came out of the Howard Avenue plant that we have now was after we made a number of changes, so I wouldn't put a lot of, that doesn't provide any kind of information that the Howard Avenue plant wasn't a problem. The problem is if I think you would have had a real ethical dilemma to keep pumping water through the Howard Avenue plant using the method that you have some doubt about. To keep pumping water out to test it would have been, I think, unethical. So we didn't do that. We made the changes and then stopped pumping water out of the plant. So what we have, the test data we have out of Howard Avenue doesn't settle that question. But other things that are being tested, the stool samples, the turbidity data that Dr. Davis and the Water Department people are looking at, those are the things that will help us determine what happened and if there was a breakdown in procedure or what happened at that plant.
Chemist Eugene Banks alleges that the turbidity levels at the Howard plant were really high the last week in March, and that a lot of this could have been avoided if at that point the water was not allowed to flow.
That may well be. It could be what happened, and it could be that it didn't happen, and that's the kind of thing we'll determine over time. There's a special urgency to making sure right now that the water is safe and that we can remove the boil advisory. But determining what happened and why and what should have been done about it, those are things that all of the research that's being done now will help provide the answers to. And then we get to what do we do in the long run? What do we do to reduce the likelihood of this happening again? And making improvements in the way the treatment plants operate is one part of that. The particular problem of the Texas water intake being in the plume of pollution is another one. And also just the level of pollution from all the different sources that make up the pollution plume that comes out of the Milwaukee River, that is another problem. And so we have to look at the long range. But right now, the thing that we're working on hard every day is to make sure that that water is safe and then be able to take off the boil advisory.
Now, you say you're encouraged by, incidentally, have there been more cases? There were 42 yesterday.
I can report that. As of today, we've had a total of 62 cases of Cryptosporidium infection that have been reported. The information that's depicted on the map, the location map, doesn't represent all 62.
Dr. Davis, when will you learn whether this cancer patient who died was indeed infected with Cryptosporidium, and what do you know about this patient that you can't tell us at this point, Doctor?
We'll look very carefully into every unusual event and certainly every death that we are informed of. And this is the first that we have heard. The information that I can share with you is that it's an individual who had already been diagnosed with cancer and was receiving cancer chemotherapy and thus had a compromised immune system, and presented to the hospital on April 6th with diarrhea and dehydration, and died the following day. We will be in contact, and I personally will be in contact with the attending physician to gain as much information as we can. I think key in this regard would be to investigate whether or not Cryptosporidium was or will be obtained from any of her specimens, and that will be a major focus.
Can you give us age on her?
No, I'm not going to release any personal identification on this individual.
The age would be personal?
Yes.
Can you tell us what hospital?
No.
It is a woman.
Can you tell us, is this person from the south side?
No, I'm not going to release any kind of personal identifiers because our job is to protect the public health, and the only way that we can maintain the confidence of people who come to us ill or in need of assistance is to assure them that they will be dealt with in a confidential way. So that's why we never, under any circumstances, reveal any personal identifiers, but we will share with you everything that relates to the public health.
As soon as, if we would find out that the organism was connected with this or was not connected with this, we will let the media know immediately.
This happened April 7th. When did you find out?
This morning, I think.
This morning, is that when you got the call? This morning? I just want to make a couple of brief comments. As far as the health department is concerned, you've heard from Dr. Davis. The city health department is still working with the state on conducting the investigation. You've heard a lot about this. We don't have to repeat this. We've had our food inspectors and sanitarians, our nurses, and our lab folks in today. We will have some people in tomorrow, although I'm going to let a few people go home for Easter tomorrow, but there will still be people available for phone calls at the health department tomorrow. I want to mention two more things. I want to just speak to this number. It's very important that people understand what this is and what this isn't. The health department recognizes that a lot of people are ill. We've had lots of reports. We have lots of records from hospitals. That is not measured simply by the numbers on this chart. This is the number simply of those that have tested positive through stool specimens for crypto, and it is not in any fashion a statement from the health department that says we only recognize these many cases. We recognize far more than those cases represented on the map. Second thing I want to say is we're in a point of spread of this disease where we worry about what we call secondary spread, and we want to remind people to continue good hygiene, wash their hands, particularly those that are with small children, changing diapers, and your own personal health habits will help reduce the likelihood of spread of this disease. So as we think of other things, let's not forget the basics and let's not continue to spread this around.
I want to add one thing to that.
That's important not only in people's homes, but that's important in settings such as in daycare settings and in settings where people take care of patients. It's very, very critical to pay attention to good hygiene in order to prevent secondary spread. In prior outbreaks of Cryptosporidium infections, secondary spread certainly has been pretty well documented.
I can understand a little bit about the chemical change that took place at the...
Let me just follow that up for one more point that I think is important. The boil water advisory is for water that is consumed by drinking or through washed vegetables or fruits. It does not apply to bathing and showering and washing clothes or plates. That is unnecessary, and we would especially like to make the point that we do not agree with the information that says that small babies must be bathed in water that has already been boiled. The problem with that is that can be misunderstood and do much more harm than good. Warm, soapy water is just fine for these activities, and that's what we recommend.
Jim, if I got to ask, you said in '92 there was a change in the type of chemical you used at both plants?
Yes.
When in '92?
In the middle of 1992, I don't have the specific date, but at that time, because of the lead test that we had in our water, in consultation and with the approval of the Department of Natural Resources, we switched from alum to polyaluminum chloride as the coagulant. We ran with that until this recent time when we switched on April 2nd at Howard to alum, and as of today, as of late today, we will be switching back to alum again at the Linwood plant. We have learned that heavy coagulation helps in the removal of Cryptosporidium. It improves the settling of the flocculant out of the water, and it also creates a nice mat on top of our filter bed, which helps the filtration process itself.
Bear with me on this one, but you changed the chemical at Howard, and the levels there are worse than at Linwood, where you never changed the chemical. You were still using the chemical change in since mid-1992. Does that throw off?
There would be other reasons for that, like, for example, the water that comes into the Linwood plant is north of the mouth of the Milwaukee River, so the turbidity is naturally lower. But they now believe, and everybody on the team agreed, that alum is a better settling agent. If you're interested in settling and not so much in the lead issue, which was the concern last summer, that alum is a better settling agent, and we want to make sure that we do whatever we possibly can to reduce the possibility, even at the Linwood plant, which we have less doubt about. We want to do everything we can to make sure that the Cryptosporidium is settled out.
But do you now have national experts doubting this other chemical as well, and that it's better to use the one that you've gone back to?
Well, we have, the national experts that we talked to said that you need strong coagulation. And our experience has been that we have stronger coagulation with alum than we had with polyaluminum chloride. That's where we're at today.
How did the polyaluminum chloride help with the lead issue?
The polyaluminum chloride is not as corrosive as alum is in the water, so it did not, it created less of a problem with leaching of lead from household plumbing.
So looking back, Jim, going with this other chemical was not a good idea.
At the time we did it, there was nothing wrong with that idea. We've worked with the Department of Natural Resources, we've worked with experts on it, and we believe it was a good decision. It is a good coagulant under most conditions. It was doing the job for us up until recently.
Mayor Nordquist, is there anything being done to address the at-risk population, specifically the AIDS patients, the cancer patients? As you mentioned, they are at a serious risk here. Is there a statement you would like to make to show them that this is being addressed?
Well, I think everyone should follow the Boyle advisory, but especially people who have pre-existing health problems. And that's why we got the word out right away 3 nights ago when this problem came to our attention, and we didn't call any particular group up, whether they were a hospital or anyone else. We went straight onto TV with it because we wanted everyone to obey the Boyle advisory, but especially people that have immunoproblems or are being treated with chemotherapy, anything that would affect the immune system, or anybody that has some other severe illness. We want them to obey this advisory. I don't know, Tom, do you want to add anything to that? I mean, we'd like to, as we get closer to the time when we take the advisory off, one of the topics that we'll have at our meetings is what do we want to communicate to people who are particularly susceptible because of previous health problems. And so that message is an important one. And when we reach that period where we're confident that we can take the Boyle advisory off, we also want to figure out exactly what message we want to have to people who might want to take even more care than somebody who's considered healthy.
Mayor, who ultimately has to take responsibility for this? Is this the changing of the chemical? Is this the chemist to let the high levels go through, or what are we talking here? What's the bottom line here, Mayor?
Well, the bottom line right now is to get the water safe and then be able to take the Boyle advisory off. In the long run, determining how it happened is very important so that the likelihood of it happening again is as close to zero as we can possibly make it. So that's an important question. It's not just a question of finding out whether somebody did something wrong. There could be procedures that are wrong. For example, if somebody would say, well, the water utility followed all the DNR procedures and met all DNR guidelines, well, that could be completely irrelevant to the issue. The fact is there may have been things that could have avoided this problem that the DNR regulations didn't speak to that we could have done or should do in the future. And that's the important question. And the primary, most of the research that Dr. Davis, the health department, and others are doing is aimed at determining what happened and how to make sure it doesn't happen again. But I do want to emphasize, until the boil water advisory is off, our primary focus in terms of the decisions we make about how the treatment plants are run or whether they're run is to make sure that the water is clean and as safe as we can possibly make it, so that it is safe for our citizens to drink.
Mayor, of the 62 cases, can you tell us how many are cancer and/or AIDS patients that have been infected with this parasite?
No, I don't know that.
I don't have the precise numbers here. We'll be tabulating all of that. We try to get this map so that you'd have an opportunity to at least know a bit about the distribution. Let me just explain a little bit about the maps because I didn't in real detail. The demarcation line generally, if you look at where the junction of water from the Linwood plant would meet water from the Howard Avenue plant, would be around State Street. Keep in mind that you have a very elaborate interconnected system of water. The population density in the south side is lower than the population density in the north side. Roughly 1/3 of the population lives in the south side of Milwaukee, and 2/3 of the population would live in the north. What we see, and I haven't calculated rates yet, it's a bit preliminary. These are just laboratory confirmed cases, and we have to look at the overall occurrence of a gastrointestinal illness, and then we'll have some more data. But the majority of cases that have been reported in individuals that have a confirmed laboratory test have occurred in people that have home locations in the south side, but clearly cases have occurred in others as well. We have a mobile population. People do move around. This particular map also demonstrates some dots out here. These are people that don't live in Milwaukee County, but they are more likely represented in the work location map, where people who this constitutes people that some people on this particular map who do not live in Milwaukee County would appear on this particular map. In addition, there are some people who do not work, they're retired or whatever, that wouldn't be represented with a work location. We'll be providing more data as we provide analysis.
Doctor, perhaps I'm the only one confused on this, but I have to ask. You're encouraged by the lower levels of Cryptosporidium at both plants, but yet the number of cases continues to rise. Doesn't that sort of beg the
I can explain that.
Yeah,
I can explain that.
That was something that Paul Nannis was talking about earlier. Let me, before you do that, let me make it as clear in layman's terms as I can. We are analyzing additional stool samples as they come in. We are not, it's not that the number of cases is necessarily increasing, but the number of cases where we have stool samples is increasing. As we expand the database, we have more accurate data from which to draw conclusions. So this number, which goes from 8 to 23 to 42 to 62, that doesn't have anything to do with the tracking of new cases, like the disease is expanding. The disease may be expanding and may be contracting. With that, go ahead.
Yeah. The important thing to represent with any infectious disease, there's a time of infection. That's when the person first gets infected with the organism. Then there's an incubation period, from the time of initial infection to the time that a person becomes ill. With this particular organism, the time from infection to the time that a person becomes ill varies from anywhere from 1 to 2 days to 12 to 14 days. Typically, it's about 7 days. So if the only day of challenge was on one specific day, you're going to have a spectrum of illness, because some people are going to get ill on day 1, some people on day 2, et cetera, et cetera. So that's the point I wanted to make. And so when you're looking at an outbreak and the word is out that people should test for certain organisms, you tend to see this happening. And it might be in people that were infected later on in the outbreak. There may be some people who were infected fairly early in the outbreak whose illness has resolved, who you'll never test. And this is a very dynamic situation. So the case count is just that. It's just a matter of, it's a part of its awareness. We will have a lot more data based on the occurrence of a diarrheal illness that is typical of Cryptosporidium, and we'll be able to have curves on that once we reach
Why don't you give them the total number of people that you took stool samples from compared to how many?
Oh, okay. Right. I think this is another thing, too. We do have background data for a variety of different pathogens, and quite a few specimens were taken during the month of March for bacterial culture. And there's the results for various pathogens such as Salmonella, Shigella, Campylobacter would be about what one would expect. It's just comparable to background rates, nothing unusual there. Similarly, the testing for Giardia was about what one would expect for background rates, nothing unusual there. With the enteric viruses that could be cultured, nothing unusual there. With regard to Cryptosporidium, during the month of March, only 36 specimens were tested for Cryptosporidium. Clearly, there wasn't as much awareness. 9 of those were positive, or 25%. So far, during the first 10 days in April, we're aware of 180 stools being examined, 53 of which are positive. Now, clearly, there's probably opportunities to sample many, many more people than that, given the fact that they're ill. Not everybody go to seek help. Not everybody is tested. So this just represents some trend data, but so far during the first 10 days of April, about 30% of the specimens tested for Cryptosporidium and people suspected of having that have been positive. And that, I think, points toward this organism as being significantly associated with this outbreak.
What you just heard was a scientific conclusion. That's not something that Dr. Davis would have said 2 or 3 days ago, but the fact that there is of the 180 people perhaps who thought they had it, such a large percentage, people with gastrointestinal orders, such a large percentage had it, means that Cryptosporidium actually is,
It seems like given the laboratory data and an adequate assessment to look at other organisms, the other organisms are not associated with this outbreak. Cryptosporidium is clearly highly prevalent in patients that have been tested in the months of March and April that have illness that is suggestive. And we'll have a lot more test results. It provides additional support for Cryptosporidium as the cause of much of this illness in this community.
Are there other things that would get past the coagulating agent that would cause disease, and is that being looked into?
Well, I just presented a variety of data on bacteria and viruses. I'm not sure about other viruses that we couldn't test for through culture. We are going to be doing direct testing of viruses that can't be cultured. Those tests will be done at the CDC. And it'll take a little while to get those results back. Those specimens have been obtained. It'll take some time, though, because they're very sophisticated tests. But we are looking at that, too.
So the Cryptosporidium is the only one that's gone over back?
Yeah, the tests that we have results for are things like Norwalk virus, Khaleesi virus, and there's a few others. And we'll be getting those specimens run. We have some good specimens to send to CDC, and hopefully they'll be processed in a rapid fashion.
Okay, and just to summarize, the initial tests are in. They're somewhat encouraging, and if the additional tests that are due in over Monday and Tuesday come in and meet our hopes and expectations, then I will modify the boil order on Wednesday. Right now it's still on. People should boil water before they drink it or before they use it to wash food. Thank you very much.
Do you have any idea how long all the testing might take? Will you be done testing by Tuesday, or do you expect
Well,
it to take
there's two different kinds of testing. In terms of, I'm glad you asked that before we left. There's two kinds of testing from my standpoint. One is the testing that assures us that we can take the boil order off. Then there's the testing that helps us identify what the problem, or even more likely, the problems are that led to this outbreak. And that kind of testing will go on for some time until scientific conclusions are reached.
Mayor, one more question. This may sound silly, but we've gotten calls from folks wondering if they will have to pay their water bills with the situation. Can you address that?
Well, they will have to pay for their water bills because anytime you have a public service, there's no way in the world that the public doesn't pay for that public service. There's no other place to collect the money from. So, yes, water has a value, and that's how it's paid for, as long as it's a public utility.